So now we will be discussing regarding qSOFA and SIRS. So qSOFA is we will say these two are very important topics, and questions has been asked repeatedly from these topics about the criteria of the qSOFA and SIRS, right? So we will see what is qSOFA and what is SIRS, right? We will discuss and then we will come back to the slide. First, let's discuss about the qSOFA criteria, their scorings and everything, right? So see, first is qSOFA. What is this qSOFA? Quick sequential organ failure assessment score. This is called qSOFA, right? qSOFA is the quick sequential organ failure assessment score. Now the very important thing is about the criteria of qSOFA. So there are mainly three criteria, right? One is hypotension. Hypotension is your systolic blood pressure when it is less than 100 mm mercury. So one is your hypotension. Next is your altered mental status, and third is your tachypnea. Tachypnea with respiratory rate more than 22 per minute, right? So these are your three criteria, and score more than equals to 2 always suggests that there is a greater risk of poor outcome. So remember these points, right? Now quickly we will discuss about the SIRS and then we will come back, right? SIRS is your systemic inflammatory response syndrome. It is actually the body's response towards an infection, right? Body's response towards an infection. We'll quickly discuss about the parameters also, which is the most important part. So in parameter section we have temperature, which is less than 36 degrees Celsius or more than 38 degrees Celsius. Second, we have WBC count less than 4,000 or more than 12,000. You can say also is more than 10% in band forms. Third, we can take the respiratory rate. It's more than 20 per minute or PCO2 less than 32 mm mercury. Pulse rate more than 90 per minute. So out of the four criteria, if any two is there, we say that the systemic inflammatory response syndrome. Now let us revise the points once again. First, I talked about qSOFA, which is the quick sequential organ failure assessment score. Criteria, there are three criteria: hypotension, systolic blood pressure less than 100 mm mercury. This is the first criteria. Second one is altered mental status, and third one is tachypnea with respiratory rate more than 22 per minute. Score more than equals to 2 suggests poor outcome. SIRS is your systemic inflammatory response syndrome. Parameters are temperature less than 36 or more than 38 degrees Celsius. WBC less than 4,000 or more than 12,000 with more than 10% in band forms. Respiratory rate more than 20 per minute or PCO2 less than 32 mm mercury. Pulse rate more than 90 per minute. If any two parameters is there, it is suggestive of systemic inflammatory response syndrome. Both are very important topics and has been asked previously. Now you can go through the slide for a better understanding whatever I have discussed. See SIRS meet two of the following: temperature is less than 36, more than 38, heart rate more than 90, SP rate more than 20, white blood cell less than 4000 or more than 12,000. This is all we have discussed. And qSOFA, meet two of the following: respiratory rate more than 22, altered mental status, 60 blood pressure less than 100, what we say as hypotension. So these are your criteria, and it's a very important criteria for your exam, has been tested many times, right? So we are concluding here, and we will meet in another video, right? Thank you.